And we're live.
Come on to learn and grow. Welcome to the Village Talk Show. Come on to learn and grow. Welcome to the Village Talk Show. We discuss what people need to know, empowering them to learn and grow. We discuss what people need to know, empowering them to learn and grow. Give praises to Jehovah, from whom all blessing and knowledge will flow. Blessing and knowledge will flow. The Village Talk Show, dedicating to empowering the community to live a healthy, safe, and financially capable life, helping each one of us in realizing our dream at any age, any point, starting from today, day. Success. Come on to learn and grow. Welcome to the Village Talk Show. Come on to learn and grow. Welcome to the Village Talk Show. We discuss what people need to know, empowering them to learn and grow. We discuss what people need to know, empowering them to learn and grow. Success is not spoken, it is done. Success is done. Come on now. The Village Talk Show. Talk Show. The Village Talk Show.
Hey, good evening. How are you this evening?
I'm fine. How you doing, Doc?
I'm good. Cannot complain. Did it stop raining?
No, I don't know.
That's awesome. So we got a lot going on today.
Like what?
Which is
what's going on, Doc? What's going on?
Just a lot. We have a guest today. We have two guests today. And looking forward to hearing one medical and one soccer. Can't go wrong with that.
Really?
Yeah. So looking forward to that. Good evening, Benev. Thank you for always tuning in and always being one of our favorite listeners. All right. We're going to go straight into what's happening this week.
But what's happening, Doc? What's going on?
So let's start with the ceasefire being over. So
Really? So that means gas prices going to go up again? What's up?
It might.
Why is the ceasefire over? What happened?
So President Trump stated that the interim ceasefire with Iran was effectively over following renewed attack on commercial shipping in the Strait of Hormuz. Thank you.
Get it right, Doc. Get it right.
All right. It's all right. So the U.S. military launched a second round of strike targeting Iranian missiles, the drone, the military infrastructures, the site. So it's on. Bombing continues, attack continues, and our gas prices will be going back up again.
So listeners, go fill them up. Go out there now and get them gas, fill that gas up, get them gas tanks, fill them up.
I think they had just opened an area in different states lowering the gas price as of yesterday. I know there's one in Philadelphia that they said where the gas price is really, really cheap. They said it was a deal they worked out. So who knows? They block the passage. They're bombing the passage. Ceasefire over. So, should military people continue to escalate the ceasefire agreement? What do you think?
Did they?
I'm asking you, John. What do you think?
I think we need to have another go round to see if this thing can be resolved. Because I think, put all this work in, I think it might be some sort of resolution. But at this point in time, instead of people taking hardy positions on both sides, maybe we need to see if we can go at another diplomatic, if we can do something else diplomatically. That's my thought process. We can't. So let's try to let's get over the goalpost.
Okay.
The goal line.
Okay.
That's my thought. We're trying to avoid this whole issue of. I'm trying to avoid the issue of any thought of boots on the ground, and this is something that we need to avoid. So hopefully the president make one last dish effort to see if this can be resolved. So I'm hopeful. I'm hopeful that cool heads would prevail. Put back to the drawing board.
Okay. So, what I thought was interesting?
What's that?
I thought that this week, was it yesterday? Yesterday or the day before, when our president went across, went international, and the Secret Service reported that he should not fly the plane that was gifted to him from Qatar. So he went into the NATO conversation with one plane and then left with another. He was worried about assassination attack. Why is he so concerned about that?
Concerned about assassination attempts?
Mm-hmm. He keeps
Doc,
talking about that.
I mean, Doc, come on, man. He was, he tried, he got shot at, he got hit. I mean, of course you got to worry about assassination. You can be the boldest and strongest person in the world, but you do not want to put yourself in a position where you end your life a lot faster than what it is. So, I mean, for precautionary measures, yeah, listen to what they're saying.
Yeah, because they said that now when he travels, he goes with two planes.
Of course.
I guess as a decoy to say, hey, he might be on this one if they do attack this one. He's on the other one.
No, they do that with the. I think they do that with the helicopters. When we're on the helicopters, they have there are three of them. So, you don't know which one the president is in.
Similar to the cars as well, right? When they're traveling local.
Yep. Mm-hmm. You don't know which vehicle he's in, because there have been attempts on his life. So we got to, so definitely, none of us want to see,
and do you think because of the war, it's even higher, a greater?
Yeah, definitely because of the war. Definitely. Come on. Definitely. Much higher.
So do you think the airplane that was gifted to him also is something that infuriates other countries? Do you think that could be a part of it?
It could be. So, take all necessary precautions.
Okay.
That's what I would recommend.
Okay. So I know a lot has been going on in regards to the president. There is one more thing that happened in regards to the name that the judge ruled. Trump's name must remain off of Kennedy Center. I agree with this. I agree with this wholeheartedly. If the center was created to recognize the former president that passed away, why would the current president put his name on?
Doc, let me ask you a question.
Go ahead.
Who cares?
Who cares?
Yeah, who cares?
It matters because guess what? It matters because
who does it matter to?
It matters to a lot of people who decide not to go there because he restructured. He totally violated some of the procedures.
Is it helping someone's kid get into school? Is it?
Well, it's wasting our tax money. It is wasting our tax money.
Tax money because he put his name on there. He's gonna get groceries on the table.
He put his name on it. There's money that's being
is it gonna lower my interest rates? So I don't care. To me,
you
that's
don't care, but guess what?
I don't care.
It's affecting us. It is affecting us
How is it affecting us? Explain,
because
please.
money that's being spent.
Because I don't want to be. I don't want. You know, listeners. I don't want to. What's up? What's up, Willard? What's going on, my man?
I
You know,
think we
Willard.
need to act.
I agree. You know, Willard says I think we need an act of Congress to check this leadership, if not check and balance. That's why we have a separation of powers. Obviously, the Supreme Court, you know, is conservative at this point in time, listeners, and that is our fault. When he ran against Hillary Clinton the first time, they knew how important the Supreme Court was. We didn't. We were concerned about, oh, did she turn over this? Did she turn over that? Oh, we don't like her. Sometimes you got to turn your nose up and just do what you need to do. And obviously, because we didn't do what we had to do when he ran the first time, we have a Supreme Court that is turning back the clock. You know, it's our fault. We don't go out there and vote. We don't like the person, or maybe the way that they look, or they said something different. The Republicans understand the importance of having power, because if you have houses, if you have the presidencies, you can effectuate policies that don't last 1 year, not 2 years, not 3 years, can last centuries. You know, so we stop getting caught up with, oh, I don't like him personally. No, this is, as they say, this ain't personal. This is about business. We need to be more business orientated when we are getting out there and voting, and understand the importance. You know, let's digress for a second. What do you think about the guy from I think Maine, Planter, stepping out of the race?
After the rape accusation, he said he is not supported. He is, well,
and this is not supported by who?
By the Democrats, because they pull the support that they have. But it is a major accusation. But here's the thing: the major accusation of rape by 2 females, and then our current president, who actually have the same accusation, and we have somebody who won the case. Same thing.
However, remember the video?
Which video? Oh, yeah.
The Entertainment Tonight video?
It didn't matter.
It did not matter. Everybody thought it was a game changer. Everybody knew all this about Trump. Everybody knew, but they knew he was the person that can get them over the threshold, because they understood the significance of having that person in office at that time to effectuate what we need to do. You know, we are always, Democrats are funny. We are always willing to take the high ground, but we do all this underhanded stuff. You know, we want to be known as the moral party, but we do a lot of stuff that's immoral. You know what I'm saying? Sometimes you have to turn your nose up, and we have to put our positions in the power. So when we are in power, then we can effectuate the change that is necessary, instead of always talking about, oh, what Trump is doing now, oh, what President is doing now, oh, what he's doing now. You know what? The Republicans knew all of this. And you know what? They did not say one word. Some did, a handful, but the rest of them were, you know what? He was our best chance to win. You know what I'm saying? And the whole point was, fine. We want our morals to exceed any policy issues, because we want to be this moral. But we're not that moral. But at the same time, then don't bitch and moan when we're not in position of power, and take advantage of these situations. You know what I'm saying? It's about being in the majority. In the majority, you can do your investigations, you can change policies. You know, we don't understand that. We're always the first ones. Democrats are always the first ones to say, resign, 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 resign. Same thing, resign. That's all we know. We the party of morals, but we in the minority. There's nothing wrong with being moral and being the majority. The whole point, but let's get the, you know, like, you know, former first lady Michelle Obama said, when they go low, we go high.
Mm-hmm.
But you have to understand what has been going on. Now, when they go low, we need to go lower. You know, doing this moral high ground is not putting us in a position where we can effectuate change and our people are suffering. That's my 2 cents. What do you think about that, Doc?
You know what? When they go low, we go high. When the whole need to remove yourself or whatever, I do not support anyone who has a major crime against them. I'm not gonna vote for you. Point blank, I'm not. Period. So at the end of the day, that is a major crime that he is alleged he is facing, and that's not who I want representing me. So it's not a moral. It's just that's not who I want representing me. That's it.
I understand that. I understand that.
They can find another candidate.
They can find another candidate.
That's it.
Suppose he's the best candidate to beat Susan Collins.
Says who?
I'm asking.
I don't know if he's the best candidate to beat her.
So the other candidate who thought about running lost. She stepped out.
Yeah, but maybe there's somebody else. Maybe there's somebody else. To be honest with you, there might be somebody else, especially when you have accusations like that. They're going to use it against you.
Accusations, you know.
But they're going to use it against you. Period.
Hey, you can use it against you, but the whole point is if you do the work. These are allegations. That's what it is. You know, we always forget, and everybody's innocent until proven guilty.
Mm-hmm.
These are allegations that need to be investigated and vetted. You know, I go back to everybody. Everybody talks about the Central Park Jogging 5. Everybody, oh gosh, they're guilty. Send them up, send them. And you know what? Nah, all these people spent 30 years, 40 years in jail. Because you know what? We are the victims of, we go along to get along. If that's the momentum of the crowd and the noise being made, we're going to jump on the bandwagon. Sometimes you got to let's stop for a second, hold off, and let's see what's going on before we proceed. So the allegations about this woman or whatever it is, my point was, why didn't we do the homework before it even got to this point? You had the neo-Nazi things. Yeah, I mean, so even with all of that baggage, he still won the primary. So why couldn't he continue to run until this whole thing is vetted out about this person about these allegations?
Well, I don't know. But the thing is, the timing, everything comes out is also suspect. But since he's been running, there's been all types of accusation back to back.
So they should have done the homework. He shouldn't have never even got in if they would have done the homework. Mm-hmm. So come on.
I don't know. So it's the same thing. Whenever when you are running for any political position, all dirt will come up on you. Your opponent will be searching for everything. If you ran a red light, they're going to use that against you. So you know that be prepared. Be prepared for any and everything to come up. That's why I never want any political party. You're not only harassing that person, you're harassing their family, you're digging up things. So it's not a one person running. It is you, your family, your friends against, whoever your opponent is and who has more money to continue to dig dirt. So.
I do agree with that, but at the same time, we need to, what do we want? What do we want?
We want the right individual to represent us. That's what we want.
We want the right individuals to represent us.
Because look,
but in the interim, what are we willing to sacrifice until we get those right individuals?
Do we compromise?
Yeah. Do we compromise?
We shouldn't. And second of all, if we're just yes people, that's how we end up having a group of yes for Trumpers.
And as those Trumpers and saying yes, they stay with the party line. They stay in the position of power.
So is that what we're supposed to do?
That's why.
Just go against party lines for everything?
Who says
even when party is wrong?
If the party is wrong, we can acknowledge that and say, hey, you guys are wrong. But at certain times, it's the end result we need to find out. We need to look, what is the end result? Can we look past this to get us to where we want to be? That's the point. Can we look past this? You know, are we willing to be right? It's just like, like Pastor Bernard talked about principle over preference.
Mm-hmm.
Sometimes some positions are principle and you have to stay strong and steadfast. They may be unpopular, but if you're a principled individual, you stay with it. And some preference, you go with the wind. You go with what the mob says. You go what is popular at the time. And this is what we as Democrats do at times. We go with what we feel where the mob is going. What
you said the mom is going?
The mob.
Okay, the mob. Okay.
The mob or the majority, who they perceive to be the majority. And it may not be the right position. You know what I'm saying? Sometimes you got to be vocal and talk about it. So, it's the now with this whole, Democratic Party, and now you have the socialists, and they want to talk about their issues. Like, how are we going to deal with their issues now?
Okay. There's a lot going on overall. There's all types of parties, all types of individuals. Some people will be happy. Some people will not be happy. But let the right individual represent us as a city.
I can understand. We got to get to the right individual, but sometimes the right individual is not perfect. Not perfect.
That is true. Or they don't want to deal with being scrutinized the way that an individual is scrutinized when they run for any political party.
But why don't we scrutinize the press and know who's doing all this stuff? Let's scrutinize them. I'm quite sure they got skeletons in their background.
Maybe not. Maybe not.
Maybe.
Our guest is on a little early, so we can bring up our guest, Dr. Braha.
Let's introduce Doctor. Come on in, Doc.
Are you ready, Dr. Braha? If you're ready, you can just put a thumbs up and we'll bring you on. Can you hear us? Let's see. Are you good? I don't know. I think I'm going to bring him on stage. All right. Hello. Can you hear us, Dr. Braha?
He's muted.
Yes. You're still muted, Dr. Braha.
Can you hear us, Doc? You're muted. Can you unmute him, Doc?
No, I don't think I could. Let's see. Yes, I can.
Do it again. Try it again.
Hello,
hey, Doc.
Dr.
Hey, how are you? Good evening,
Good.
guys. Thanks for having me.
Good evening. We brought you in a few minutes earlier. Thank you for joining us this evening. You have an amazing topic that you're going to address with our listeners. And listen, anytime you come on, that is important information for everyone. So thank you for being on this evening and for joining us, the Village Radio Talk Show crew. This evening.
It's great to be here. Always fun to talk about health and keeping up our health, preventing disease, especially when it comes to something that's near and dear to our hearts as gastroenterologists, like colon cancer. We're lucky to work in gastroenterology. It's a field where we can prevent cancer, not just detect it, but prevent it in the first place. So always exciting to be somewhere with the community, whether it's online, in person, churches, synagogues, mosques, anywhere where we get invited to talk. We know we're going out there to help people to prevent cancer.
That is true. That is something that is every time you turn around, it seems as though someone's being diagnosed with cancer. Either colon cancer, either breast cancer, either any type of cancer. So it is something that is damaging and affecting our community. But people like you help this situation and help the way that we deal, we treat, and we can prevent. So let's get started. So we're gonna start off in regards to um, we're excited to have you, but unfortunately, the last time you were on, we had our famous host, the greatest host ever, which is Roderick, and I think you used to treat him as well, correct?
Yeah, a great loss to us. Fabulous, fabulous, gentleman, talented, knowledgeable, influential, a good friend.
Yes, yes, he is. He is. And how do you're unique because in the way that you blend endoscopic medicine within the alternative and complementary alternative medication. Do you come across a lot of people who are afraid to try like chemo or anything that's abrasive and they want to choose an alternate way of
Doc, I think before we get into that, maybe
Ooh,
you know,
introduction?
doctor, not only introduce but also tell us what the specialty is, so we understand. He's a GI doctor, and what does that entail? And
Yeah, sure. Great question, and yeah, I'll introduce myself for folks that are watching. I'm a gastroenterologist. I practice in Brooklyn. I grew up in New Jersey. I was going to be a doctor from the time I probably could start talking.
Mm,
Everyone knew I was going to be a doc. The question always comes up: how did I end up as a gastroenterologist? And the path to becoming a physician is long, and the path to choosing your specialty is challenging. And gastroenterology is near and dear to our hearts because we have family members with colon cancer who died of colon cancer. And throughout my medical training, it was really exciting to find a field where we can prevent a disease and do something about a cancer. Pneumonia we could treat with antibiotics, and most people are going to get better. A respiratory infection, it's going to go away. Someone who gets gastroenteritis, they'll get through it. Cancer is still what's on our minds all the time, especially as we age, worrying about getting cancer, how can we prevent it? And so gastroenterology was just a natural choice for me. And so I'm a board certified gastroenterologist. I work locally in Brooklyn. We have a practice in Sheepshead Bay. We have an office on Bay Parkway as well in the Bensonhurst area. I'm involved with some of the local hospitals, particularly Mount Sinai Brooklyn, which is located in Midwood, where I direct the GI service there, the gastroenterology service there, where we take care of lots of emergencies and patients who come in the hospital for various different things. Most of the time, they didn't expect to be in the hospital that day. But the majority of my practice is counseling patients on gut health and how can we maintain a gut health? How can we keep you healthy from a GI gastroenterology standpoint, especially when it comes to preventing cancer, because we know colon cancer has risen in our young population. And we are seeing about 25% of colon cancers now occurring at a young age, meaning people in their 30s or 40s. We used to think of this or know of this as a disease in people over 50. And so you brought up a good point there about young people really worried about cancer. When I was growing up back in the 80s or 90s, we didn't talk much about cancer, amongst 20 or 30-year-olds like we do now. And so it's a great point that you brought up. So that's my job. That's my role. That's my life. This is what I do. That's my meaning in life is being a physician. And, as a gastroenterology specialist is really trying to help people and guide them when it comes to colon cancer prevention. But not only that, we're dealing with an epidemic in this country of obesity, overweight. 60% of our country is overweight. We deal with liver disease. Fatty liver is a big problem. We're finding this in more and more of our patients because the majority of our country is overweight. And it leads to a metabolic syndrome and liver disease and raises the risk of liver cancers. We're seeing liver cancer in younger patients, cirrhosis in younger patients, simply from poor dietary habits, poor exercise regimens and being overweight. So, those are two great things we could talk about today. And, I know you have some questions. So
That,
where
that
should we go from here?
Hey, Doc, did you want to, they talked, I remember as I got older, they're saying, 50 years old, your first screening, but first screening for colon cancer, colonoscopy, or whatever it is. But quote unquote, it was at when you reach 50. But I hear now it has, you know, it's no longer 50. If you have a history of it, or sometimes you can start as early as 40 years old or in your 30s. So, I mean, can you clarify that if you can?
Yeah. So, during the pandemic, as the data kept coming in about the risks of colon cancer in young people, they changed the age about 5 years ago to 45. So everybody, across the country should be screened at age 45, but not everybody is equal. There are patients that are at a higher risk because of a family history, especially when it comes to first degree relatives. So if you have a mom, dad, sister, brother, large population, our risk of developing colon cancer is about 5%. So 1 in 20 of us will develop colon cancer in our lifetime. If there's a family history, that risk, especially if it's a young person, if they developed it at 60 or 50, 40 at a younger age, that risk can go as high as to 20% just by having one person in your family. Years before someone got colon cancer, or 10 years before they had a significant polyp. A polyp is a precancerous lesion. And so you have to talk amongst the family. We have to be open about our history. And I remind patients that after a colonoscopy, especially a young patient, we'll tell them, hey, listen, when you're going to the bathroom, you poop in the bowl and you happen to see some red stuff down there, that's an alarm. And ages ago, I've been a physician for 20 years. I want to say when I started out, there were still people that would reassure patients, inappropriately so, and say, oh, well, if you saw a little blood only when you're wiping, that's okay. It's not okay. Blood is an alarm feature. It can be the first sign of colon cancer or the sign of a polyp, which can lead to cancer, and many other diseases. So blood is an alarm feature. Changes in your bowel habits where, you were going every morning for 20 years and all of a sudden you're skipping 4 or 5 days at a time and it's hard to go. You were going normal forever and now you have diarrhea for a month or two. If you get diarrhea for a week, yes, most likely that's an infection. Most likely you ate something bad, you caught a virus. But if it's prolonged beyond 2 weeks, especially beyond 4 weeks, you want to get into the gastro office. So changes in bowel habits at any age might prompt us to do a colonoscopy.
What if somebody mentioned that maybe it's something that I ate, or I'm constipated, or whatever? We hear a lot of that. What are some things that's causing them? Maybe they ate something that's causing them to be constipated.
Yeah.
So how do you know the difference?
Well, we tease out the history.
Okay.
When we talk to somebody, we want to hear their story. How did this start? What were you doing before? We take a sort of what we call a 360 holistic approach, where tell me your story. Let me see how you got to this point. Sometimes constipation, most of the time, I don't want to say sometimes, most of the time constipation is benign, right? Constipation doesn't always lead us to a colonoscopy. But you can hear their story. Well, I hurt my arm last week. I went to the emergency room. They gave me some pain pills. The pain pills caused constipation. Or, the patient just started doing an exercise regimen over the last month where they're running outside and they're sweating. It's 100 degrees and they're clearly not hydrating well. And that's one of the first steps in treating constipation. So you want to hear their story. You want to hear their diet. What's their family history? What's their social history? Are they a smoker? Are they a drinker? What are their risk factors? Not just, hi, I have constipation, here's a laxative. You have to appreciate the patient's story. Everyone's unique. And then decide on what the next steps are. And if there's alarm features, if there's changes that aren't resolving with simple treatments, oftentimes we're going to end up with a colonoscopy to prove, hey, that there's no cancer, no tumors, colitis, and other diseases. So we have to hear the story. You got to come to us. We want to hear what you have to say. We're here to listen to you and appreciate what brought you in.
And there's a fear tactic too. A lot of males really don't want to go to the doctor to go and get a colonoscopy. Females too. Anything that is, foreign to them to actually take exam. It might not seem too great Do you come across that often?
Yeah, there's two questions I hear every day. Is number one, how did I end up doing colonoscopies? Why would anyone choose to do this? And as I explained to you, to me, this is the greatest, field because I get to prevent cancer. And the other question is, Doc, how am I going to do this? This sounds crazy. And, it is a challenging exam. We don't lie to patients and sugarcoat it. It is definitely better than it sounds, but there is a 24-hour process to it. 24 hours before you're going to have a colonoscopy, we're going to change your diet. We're going to put you on a liquid diet. We're going to modify things. We're going to start clearing out the colon. We're going to hydrate well. We're not going to have salads, fruits, vegetables, solids. And the night before the colonoscopy, or sometimes the morning of the colonoscopy, we're going to give you a laxative to drink. And you don't leave the house once you start drinking this laxative. And you're going to go to the bathroom a whole bunch. You've been there, right?
Yeah,
it's not pain. I'm at 5. I'm at 5. There are better tasting ones these days, and there's smaller volumes these days. Patients do appreciate it. My last colonoscopy, not the gallon. No, not unless you need it. There are some patients we have to use the gallon. Dialysis patients, heart failure patients, but that's a minority of people. The preparation is not painful, but you're going to be in the bathroom 5 or 10 times. You're going to be pooping out some water, liquid in, liquid out at some point. But cleaning out that colon removes the liquid, the stool, and allows us to find these polyps because they're tiny. They're like the eraser on a yellow pencil. The cleaner the colon, the better it is for me, the better it is for the patient. We give you some great medicine during the procedure. You're sleeping for 15 or 20 minutes with a good sedative.
That's the best sleep you get, boy.
It is incredible sleep. I'm telling you, the last time, or the time before that, I had a colonoscopy, and a buddy of mine did it for me. And I hear him talking in the background, obviously after the colonoscopy's over and the drug's wearing off. And I yelled at him. I said, "Quiet! I'm sleeping here. This is the greatest sleep in the world." And that's the reward. It is a bit of a struggle, or they say no pain, no gain, but there's no pain to this. You have to go through the process to get the reward, and the reward is that. Number one, if I remove polyps from your colon, we're reducing the risk of colon cancer over the next 10 years dramatically. There are some studies out there that, we could reach a 90% risk reduction. You can't do this for prostate cancer. You cannot do this for breast cancer. You can't do this for skin cancer. Colon cancer is very unique in that we can prevent it, not get to that point. We can prevent it by removing the polyps. The last time I looked at my data in the office, about half or more of my patients have these polyps. They're called adenomas. And you can't feel these things. You don't know you have them unless they're tremendous or just about to become a colon cancer. They're asymptomatic.
How do they develop?
We don't know. We wish we knew. We don't even know why people are getting colon cancer at a younger age right now. There are some signals, in the research. Maybe it's more preservatives, processed foods, more meat intake, more alcohol. Certainly the obesity epidemic doesn't help us because we know being overweight or obesity contributes to all cancers, including colon cancer. So we don't know why people develop these outside of a family history or a DNA mutation. And that's why we screen everybody. It's like the airport. Everyone has to go through the metal detector. Not everyone's carrying the bomb. Not everyone has a gun on them. But everyone goes through the screening at the airport. The same with colon cancer. Everybody, men, women, 45, earlier if there's a family history, you got to do it. And there's a lot of apprehension, like you said, but you have to think on the other hand. For 24 hours, I'm going to change my diet. I don't want to go through chemotherapy. I don't want to go through surgery. You got to think about that.
So what about those?
What about
people?
the end of? Oh, I'm sorry. Go ahead, Doc.
Sorry. What about those people who say, "Hey, I don't want a colonoscopy, but I'll do a colonic"?
So a colonic is, first of all, it's not a medical thing. This is done by people who are generally, not medical professionals because there's no data to support the use of a colonic. A colonic, depending on where you go or how you do it yourself, is an enema. And they could be dangerous. It's not done by a licensed medical professional. If it is, then they're deviating from, the quote unquote standard of care because we really don't have medical indications, randomized controlled trials, et cetera, saying, hey, people should have that. And so I have had patients come to the ER where they've been burned by these, whether it was from temperature or from a chemical burn. We have seen perforations where the colon has burst from this, infections, hepatitis, not something that is used for general health, and from our standpoint as gastroenterologists or physicians. So,
Doc, what about those? I just had a colonoscopy and also
endoscopy, right. That's to look at the upper digestive tract. We don't do this for everybody. It's not like colonoscopy where everyone should have one at a certain age. An endoscopy in America especially is really used as a diagnostic tool, where if someone has symptoms, prolonged heartburn that's not getting better, trouble swallowing food, persistent vomiting, aches and pains with meals that we don't have a good explanation for. We do an endoscopy to search for ulcers, to search for dangerous reflux where it's led to something called Barrett's esophagus. That's where reflux over the years, especially in men, can lead to dangerous changes at the bottom of the esophagus where it can increase the risk of cancer there. We do it when someone has anemia, right? We didn't touch on that. So if someone has anemia where the iron levels are low, we do a colonoscopy to search for signs of blood loss, or we do an endoscopy to search for conditions that can lead to a low iron or blood counts being low, like celiac disease, ulcers, tumors, cancers of the upper digestive tract. If there's a family history, so if someone has members in their family with stomach cancer, we'd like to see them talk about the need for what you had, which is an upper endoscopy. There's no prep for that, just so everybody knows. You don't have to drink any laxatives to have your stomach checked. But it is an exam that is sedated as well. It takes about 5 minutes. We give some of that medicine that everyone likes to get to make them comfortable.
That's a good.
You said like to get? That is false.
Our patients, they're so happy after. Doc, give me more. Give me more. No one has ever complained about the sedation. They're so happy to wake up comfortably.
Sherry-Ann. Yeah, I remember that just a couple of months ago. That was the only thing I know. I was on the table. They're talking to me. Next thing you know, I'm waking up in recovery. I'm like, damn.
But isn't it a relief when you wake up and you're comfortable and everything is okay, and you kind of get that sensation? Wow, I'm glad I went through this, and I'm glad I did it.
Yeah, no, I had both done at one time. So
yeah, we do that. That's for sure.
Definitely. And I think a lot. Preventive medicine is the best. Catch things early before they metastasize to something greater. And
that's what you're saying is exactly correct. And how I pitch it to patients in the office is, this is a cancer prevention test. We used to refer to it as early detection. To find colon cancer early is really, that was the drive in the past. And then the data comes out that removing the polyps dramatically reduces the risk of colon cancer. And so this is a cancer prevention test. That's important what you said.
Yeah. Anything that prevent you getting even worse, or help you live one more day, is definitely worth doing. What is the youngest patient that you actually have come across with any of these? So that parents know, hey, you know what? This is not only, like you said, it's not only for 50 and above, but young folks are getting it.
Yeah. So I see adults in practice. I'm not a pediatric gastroenterologist, so I've seen patients with cancers starting at 18 and all the way up the spectrum. We've had patients come to us who are 85 years old. They're running marathons. They're on the bike every day. And they say, hey, listen, am I too old for a colonoscopy? Well, when was your last one? It was 10 years ago. Okay. You have a family history, et cetera, et cetera. You're 85. You're in great shape. We'll do a colonoscopy. I've had patients in their 80s and 90s go for surgery to cure cancer. But it's the spectrum.
You just mentioned something interesting, because I'm finding that a lot of older folks in their 90s, in their 70s, their 80s are coming across colon cancer, and this is something I'm noticing in my family overall. So at this age, there's not too much they're going to do or operate on someone in their 90s or their 80s. What can you say? How do you prevent that, when it pops up 80 something years old that you end up having colon cancer?
Right. So the first thing is the majority of patients that I have met with colon cancer never had a colonoscopy, or it's been a really long time ago. They missed a follow-up, or it's more than 10 years. So that is my clinical experience, here in New York, is that the majority of patients that I've met who have a new colon cancer never got checked. Focusing more on your question, in the 80s and 90s, the old cliche of age is just a number, right?
Yeah.
There are 60-year-old patients who walk in the door who have a new colon cancer who are too sick to go to the operating room because of significant obesity, heart disease, lung disease. It's sometimes more risk than benefit to take them to the operating room. It's sad. And like I said, I have 80 and 90-year-olds where the surgeon meets with the cardiologist, meets with the neurologist, meets with the lung specialist and the family. And they have a group approach to this where they say, hey, what's the risk? What's the benefit here? And there are 80 and 90 plus year old patients who do go to the operating room to have their cancers removed, and they're cured. But the risk goes up with age, right? We do have a higher risk of developing cancers as we get older.
Now that part I didn't know. I did not know.
As we are exposed to the environment, as we're exposed to toxins, the more time we have for our cells to get damaged, the higher the risk of these mutations that lead to cancer. But just because someone's 80 doesn't preclude them from any of the treatments that we do. 90 doesn't preclude them from any of the treatments. But if they're 90 with dementia, they don't know where they are, they have no or zero quality of life, so to speak, right? You might take a step back and say, is this a time for palliative care where, going to the operating room, giving chemo, giving radiation really is more risk than benefit. And we have to appreciate at some point in our lives, for all of us, there's going to be a point where the risks of treatments, of medications, the risks of things will likely outweigh the benefits.
No, definitely. Welcome, Ms. Richardson, to the show. But I think, Doc, I think also you have sort of like a holistic approach you try to encompass in the practice that you have.
Yeah, the holistic approach for me and for most of us is, let's try to appreciate the family, appreciate the patient. Where are they coming from? What's their medical history, right? What's their family history? Why do they have heartburn? Why do they have constipation? It's very easy to walk in the room and say, I have heartburn, here's a pill, right? It's a 30-second visit. How's your heartburn? I still have it. Okay, take another pill. That's not how we should be practicing. You need to get the patient's story. How did we get to heartburn, right? When I look at a patient, are they overweight? Are they exercising? What's their diet like? Is this somebody who wakes up at 4 o'clock in the morning, has a 2-hour commute to work? They have poor sleep. They have poor diet. They're working their butts off to make ends meet. How is stress playing a role, right? What is their anxiety? What is their depression levels? How is that contributing to heartburn or to their pains or aches? You really have to take a 360 approach to a patient. It is very easy to walk in the room and just prescribe a pill. And the truth is, they'll feel better. But did we get, that's not how we should be approaching medicine. We have to take into account everything that's involved in this patient's life. Their DNA, mom and dad, what did they have? Maybe they have a history of esophageal cancer. The heartburn's been going on for 20 years. It's an obese man. I got to think about Barrett's esophagus. They need an endoscopy. I have to spend more time talking about diet and lifestyle changes than how to take a medicine every morning. And so holistic approach is getting a good history, appreciating everything that's contributing to how this patient got to me. And then, yes, there's medications that work and we should be using them because the data supports them. But there's also other things to treat patients with. What are they having for breakfast? How long are they in the gym for? What types of exercise are they doing?
Wait. The gym, how does the gym, you gotta go back. How does the gym affect this?
Absolutely. Physical fitness contributes to a reduction in colon cancer or other cancers. Being fit, getting physical activity reduces the risk of diseases, whether it's heart disease, lung disease, There's probably data out there with Alzheimer's and dementia that people that are exercising more or playing racket sports. You have to look at illness and health, right? Even though someone's healthy, they still need a physician. They still need help. But it's not just, hey, here's a pill. Yes, if you have awful heartburn or reflux esophagitis or you have awful constipation, you want the pain to go away. You want to go to the bathroom normally. Sure, I can give you something to help with that. But there's more to the story here. Patients come in all the time and they have rough jobs. They wake up at 4:00 in the morning. They grab something, a snack. They're out the door. There's no time for the body to start moving their bowels, the natural circadian rhythm in the morning. They get the urge to go to the bathroom. They don't have time. I got to hold it in. There's a subway I got to get to. And then you're on the subway and they don't go to the bathroom. They don't poop. And this goes on for months or years. And they come in and they say, Doc, I go to the bathroom once a week or maybe less. And, constipation is a huge complaint that we see. And there's many reasons for it. It's not just here's a laxative and you end up on the toilet with an explosion. There are things you got to take into account. That's the holistic approach to medicine is appreciating your patient's story, not just throwing a pill at them, not just telling them, hey, eat a bowl of cereal in the morning, but say it's a female who's had 4 or 5 babies. Do they have pelvic floor dysfunction? We can give them all the fiber and all the laxatives in the world. But maybe they have pelvic floor weakness. We need to get them into a specialist in physical therapy who specializes in pelvic floor rehabilitation or what we call biofeedback. And I've had patients who have seen 6, 7 doctors. They've taken every laxative. They put it on my desk, bottle, supplement.
Very answer.
And they say, I'm desperate. And you listen to their story. I had a difficult delivery. I had episiotomy. I had surgery. I had pelvic surgery. You send them for physical therapy of the pelvis, which it's not a medication. It's not a supplement. It's getting into the gym with a properly trained physical therapist. 6 months later, they come back, doctor, you changed my life. I didn't do anything. I sent you to a physical therapist. You just had to listen to the story. That's very important with any of the, with anything in medicine, but especially in gastroenterology. We deal with a lot of IBS. I'm not sure if any of the viewers out there have irritable bowel and been diagnosed with that. But you mentioned the gym there. That's another disease where, hey, I get patients into the gym, physical exercise, emotional health, yoga, get that vagal tone up, talk to a therapist. Most of the time we get patients better with IBS. We don't use medicines for that.
So just the change in the lifestyle really help.
Lifestyle change, definitely.
We live in a tough world. People are stressed,
Yes, all the
that
time.
That affects everything. Cortisol levels, our GABA levels. You think of all of the buzzwords that are on TikTok and Instagram. There's a lot of chatter about it, right? People talk about
how do these operations, bariatric operations,
right, for weight loss.
Yeah, weight loss. What's the impact? Do they have any impact at all on, the colon cancer or?
Sure. Sure. Anything we can do to bring the body mass index, which is a calculation of your height and weight. Okay, so normal BMI, if anyone watching wants to look it up right now, Google BMI calculator, you plug in your height and your weight. It's a pretty good indicator of obesity. Right? So overweight is over 25, obese is over 30, and then there's different gradations. We know that when the BMI goes up, say for every 5 points that BMI goes up after someone's overweight, the risk of cancer, the risk of colon cancer goes up. Wow. Yeah, there's some data where they looked at BMI, okay, and a young patient who was obese had up to nearly a double the risk of colon cancer under 45 if they were obese. And the risk for men, if their BMI went up 5 points, the risk of colon cancer can go up 30% for each time it goes up 5 points. And so when we talk about bariatric surgery, where the surgeons will shrink the stomach so people eat less, or they'll bypass the stomach so we absorb less calories, or we also talk about the weight loss medications like Ozempic, Wegovy, tirzepatide. These medicines help reduce our BMI.
Mhm.
Anything you can do to get towards a normal BMI of 25 or less. Okay, we see association with a reduction in cancers, including colon cancer, and every other disease like heart attack, strokes, vascular disease. It's a very good point that you brought up. Anything we can do to lose weight and get normal is going to be beneficial.
So get out there and get active, so
Absolutely.
that the BMI drops. So I'm fascinated about the fact that you said if it's 5 and above for men,
Every 5 points they go up. So say their BMI is 30.
mhm,
Men and women, for every 5 points you go up, the risk of colon cancer goes up.
okay,
And significantly for men, maybe 30% for every 5 points. Women, the study showed maybe 10 or 12% that it went up.
every 5
There's
points.
a correlation as each time we go up with our weight of other diseases increasing and increasing.
So being big, I'll tell you this: in certain culture, the bigger you are, the better and wealthier they believe that you are. The healthier, the best. But listening to our physical doctors, they're saying being big and being overweight, it's not healthy.
It's a sign of disease. It's a sign of disease. It's a predictor of disease. It's a predictor of mortality. We have a problem in our country. We have a problem in our city and the 5 boroughs. Our kids are overweight. Our kids are obese. It leads to problems in adulthood. And everything in gastroenterology is affected. The liver, the pancreas, heartburn, reflux, cancers. We have to encourage our youth. We have to start with the young to be more physically active. We have to promote it in our schools. We have to promote gyms. We have our parks. New York is a running city. You go on the West Side Highway, you go on the east, to the east side. You see people running. We just need to we got plenty of space.
Move.
It's funny that you said that, because our next guest that's coming on is actually someone who's very physical, who's also in the gym, who's also, promote healthy lifestyle of getting physical. So I am so glad that you mentioned that, hey, getting active, hey, doing what you have to do, taking care of your BMI, your health, overall health, weight is so, so important, because
Yes.
that is a preventative medication as well.
It's a great segue, because that's part of holistic care is, you have to look at food. What are we eating? Avoid the processed foods. Avoid the things that sit on a shelf for 10 years. Avoid fast food, these chemicals, the deep fryer. Okay. Then look at exercise. Look at physical activity.
So
Right? Your next guest is a great segue.
Wait, I'm going to introduce you. So hold on 1 second. I'm going to bring him up into our screen. Hey, Mr. Marvell, how are you? We have you live, and it's amazing that you're on along with Dr. Braha. So he's speaking about healthy ways of preparing and preventing cancer, and it segues straight into you about the lifestyle change, about making sure that you get active. Dr. Braha just mentioned that, and I mentioned that this is what you do on a daily basis.
Yes.
So Marvell, introduce yourself to us.
Yes.
Good evening, everyone, and thank you for the opportunity to join the group chat, and I'm happy to be here. It's an honor to be here, because really, like, I'm lost for words. Let me just gather myself for a moment.
So
Joanne, how you doing, Joanne?
the doctor mentioned about physical workout,
Yes.
and how that impact and prevent cancer. So
Yes.
can you elaborate on that? Dr. Braha just talked about how it is so important to make sure that your BMI is regulated, that eating, that workout. Can you elaborate on that, please?
Yes, it's a whole umbrella, like
There you go.
the workout, the nutrition, the mindset, right? Like try to maintain like a peaceful mindset, less stress. Okay, having better circulation, right? Because the more oxygen we get through the system, right, the more we promote healing, right? Well, with a ill diet, what that does is like it just put the body in a retardation mode, whereas like certain vital organs are not receiving enough oxygen, so therefore like the brain doesn't recognize them as being functionable, so they stop sending messages, and the nervous system shuts down, and that part of the body just becomes cancerous. That's my
Yeah.
perspective. Yeah.
So we spoke about being overweight and the side effect, not the positiveness of it. Because I know that you come across a lot of different individuals who are overweight. And what are some things that you can share with them, especially overweight is tied to a good indication of cancer or can contribute to cancer? How can you elaborate to that conversation?
Well, before you elaborate, Marvell, let's tell us about yourself. Tell us what you do. Tell us,
Dr. Braha, I'm sorry, we just kept you on. Hold on. Before you do that, Dr. Braha, please share your information for our listeners, because I know people will be reaching out to you, and I don't know how long you could join this conversation, but I definitely want people to know that this is an important part, making sure you check out your whole body. There's key signs, telltale signs to pay attention to, and how can they reach you?
Yeah, sure. So, we went over a lot of information. I think Marvell's going to offer a lot, regarding physical activity, physical fitness, and that's so important. But we talked about today some alarm features, definitely want to get into us. If you see blood when you poop, you're losing weight without trying, there's anemia, bowel habits have changed, you don't feel right. And if any of these are coming up, don't ignore the symptoms. Men too. Men, you got to get in here, okay? Men are tough. An old mentor of mine once said, if a woman comes into the ER with chest pain, it's heartburn. And if a man comes in with chest pain, he's going to die, because men wait till the last minute, okay? And so men, if you're listening, don't be ashamed. Don't be embarrassed, okay?
But hey, Doc, it might be the woman that caused the chest pain.
Cut it out. It is real cute.
John, let me tell you something. Women save men's lives. I can't tell you how many times girlfriends and wives have dragged their husbands and boyfriends in to get a colonoscopy, and I have found polyps, and I tell the girlfriend, I tell the wife, I tell the mom, you saved their life. And we're just genetically different, John. Marvell, some of us genetically, men don't go to the doctor on time. We have to be more into ourselves. Colon cancer affects men and women. It's an equal opportunity cancer. It really goes after us both. If you're interested in seeing us, we're in Sheepshead Bay down on Emmons Avenue. We're at a great location by the boats. If talking about exercise, you can see me go for a great jog around Sheepshead Bay. It's beautiful. 718-368-2960. That's 718-368-2960. Call us. If you do for colonoscopy, don't put it off. Summer's a great time to get things done. We do these procedures daytime. We do them nighttime. We do them on the weekends. We're happy to see you. I'm excited to see you. I love finding polyps and removing them and getting the joy of knowing that I helped somebody prevent colon cancer. And so I do have to sign off at pretty much at this point, because I have another engagement soon coming up that I got to get online for. But what I want everyone to remember is 45 is the age. Men and women, let's get a colonoscopy. And I'll hand it off to Marvell, because if he's going to talk about eating healthy, physical activity, and exercise, he might do a better job than me of keeping you out of my office. Okay.
No, you're doing a great job.
You're necessary. You are so necessary. I was trying to put up the banner, but I'm having a little trouble.
Sure.
It's 718-368-2960, and is on Emmons Street. What's the name of? Yeah, so we are Brooklyn Gastroenterology and Endoscopy. We're a part of the Allied Digestive Health Group. We also have offices in other parts of Brooklyn. When you call, you can ask them for maybe a location nearest you. But the train stops by us, the buses are by us. And, Sheepshead Bay is just a beautiful area to just come down, especially in the summer after the visit. Go for a beautiful stroll, get a nice meal. We're close to Coney Island. You hit the boardwalk. You'll impress me if you tell me you're here with your sneakers for a jog. Okay. And we are here to help you. Yes.
So thank you for having me on. It's been a while, and we're out there all the time. Every week we're giving a talk somewhere in the community, online, in person, because it is important to spread the message that by seeing a gastroenterologist, we can prevent colon cancer. Not just find it early, which is great, and to cure it, We can prevent it in the first place. Who wants to end up in the operating room? Who wants to end up on chemotherapy? We don't want to get there. We want to prevent colon cancer, and the only way is a colonoscopy.
Thank you. Thank you. And
Right,
please
Doc.
do not be a stranger. We thank you
Doc.
so much.
Doc,
You want to
Thank
say
you, Doc.
something, Marvell?
sorry, Doc. You do the internal stuff. I do the physical stuff.
Let's do it, baby. Okay.
I know nothing about the internal stuff, but I know about the body.
Don't worry. You make them look good. I'll take care of the rest.
That's it.
Thank you so
Fuck
much,
this shit.
Dr.
God, listen,
Broha.
guys. God bless you all. What you
Thank
do is amazing, and I'm happy to come back anytime. I think we should maybe spend some time talking about liver disease in the future because.
Absolutely.
Yes.
All right.
All right, have a
Jeez.
good one.
Signing
Thank
off,
you.
and
Thank you, Doc.
wishing you a great night, everybody. Thank you all for watching and having me.
Thank you so much, Dr.
Likewise,
Broha.
pleasure.
God
Take
bless.
care.
God bless. Be well.
All right.
Hello, y'all.
Hello,
Hey,
hello, Mr.
Marvell, how are you,
Marvell.
sir?
How are
I'm
you?
doing
Can
good.
you introduce yourself to our listeners, please?
Yes, my name is, well, my government name is Bertha Lewis, born and raised in Port-au-Prince, Haiti, in a little small town called Mayotte. I don't know if you guys are familiar with that town. It's like, suburbs, past Peggyville and those places. Migrated to New York, 1987. Been living here ever since. Traveled the world, a few years, live overseas, England, Germany, Holland. That's where I spent my soccer careers. Right. From Haiti, never played soccer in Haiti really, only like on local teams in the neighborhood on weekends. And transitioning to New York, was a whole different life. But I'm here today, and then the past has brought me here with all the knowledge and all the experiences I've gathered. Now at this present time, I'm a mentor, soccer coach, personal trainer. Dr. Brian knows that because she's one of my patients.
Yes.
Yes. So yeah, this is where I stand right now. And then thank you for having me on board.
Thank you. Thank you. We have the World Cup. Actually, segue from Dr. Broha. We're going to come back to that. But right now, we have the World Cup. We have the soccer series happening. The United States got eliminated this week.
Mhm.
Haiti got eliminated last week. So tell us, what are some things we should pay attention to? Who's up in the running? Who are you rooting for? And what should we know about soccer?
Well, at this point of the World Cup, really, it's been very disappointing.
Why?
Yeah, because it's not the game has changed. It has become. Listen, I'm not going to talk about politics, but it has become very political right now. Okay, there's a lot of injustice, a lot of unfairness going on, a lot of foul play going on. It's like certain decisions are being made, and it's like it goes against this player, but it doesn't go against that player. Okay, so this
It sounds like the referees in the New York Knicks championship.
exactly something like that. You know what I'm saying? Somebody's always being bought. Somebody's always being bought, and then right now they're taking the fun out the game. Look at the prices of the ticket. Ticket prices are sky high.
Yeah.
And then people are getting kicked out of the country. You can't stay here. This World Cup is just a mess. Right now, I just stopped following because Brazil is knocked out. I had a friend of mine who cried tears because Brazil was knocked out. Right? But let's talk about Brazil. Brazil is like mostly every Caribbean nation team. All right? Whether you're from Haiti, right? You're going to support Brazil. I know some Haitians support Argentina. I'm a Brazilian fan. Right? So the Brazil that I know today, I see today, it's not the Brazil of old, right?
Tell us about it.
The players of old, these guys have history,
Right.
they have a past,
Right.
they have to climb up the ranks, they have to sacrifice.
Right.
Okay, you have some of these guys who were walking around bare feet, playing soccer bare feet in the ghettos of Brazil, right? True talent, passionate, determined, right? They were given the opportunity. And they took it. And those players are the ones who paved the stage right now for these new guys to come and step on. But because it was prepared for them, right? They don't have they lack the zeal, they lack the passion, they lack the fire. So now Brazil is no longer respected and feared like of old time. Any team that used to step on the field with Brazil back then, it's like you were shaking in your boots before you even get on the field.
Right.
Because you're going up against Brazil. And even if you were to score a goal before them, You were still shaking because you know in a minute they're gonna come back and beat you 3-4-5-1. It's not the same. Soccer has changed. There's no longer soccer superpowers now. The game is being balanced out.
So what's wrong with that? What's wrong with
Hmm?
that? What's wrong with that?
No, there's nothing wrong with that. There's absolutely wrong with that because there's no more superpowers in the game. The game is fair now. It's fair play for everyone. But what I'm saying is Brazil now, they need to up their tempo because everyone has caught up.
Right.
The style that Brazil play, everybody's playing this basically the same style of soccer right now.
Right.
Every country around the world has become skillful players because now you have these leagues that are entertaining players from different countries, or these players are being exposed to a different level of playing, different level of mentality, which is raising their standard of playing.
Mm-hmm.
Look at a team like Japan. They took Brazil down to the wire, to the last minute. Back in the days, they would have taken care of Japan like this, 1, 2, 3, down to the wire.
So let me ask you a question. When you actually used to play soccer, what were some of the things? Because I heard some of the players and read about some of the players mentioning some of the issues that they came across coming to the United States or discrimination that they felt playing soccer.
Yeah.
You mentioned, hey, people are being deported and sent back after they play, or they can't get a visa to come and play.
Yeah.
So can you elaborate on that portion?
Like I said, this sport right there, this is like a political matter, right?
So touch it.
I'm not a politician. I'm not into politics, right? Because it seems to me like it's just a handful of people that are being handpicked to be picked on. Okay, whether they are marked as terrorists or whatever, they have they speak against the United States, whatever it is the cause may be. Right? See that certain people are singled out and we're not allowed to come in the country. I mean, how can one person?
Even referees didn't speak against the United States.
Right. But how can one person pose a threat to an entire nation when he has to go through an airport and get checked and all that stuff? Okay. Security is so tight around the stadium. So how can one person in just come in and just destroy and just create chaos? It's just politics. To me, that's my perspective on it. So it's like, I'm gonna punish your player to get back at your country or whatever, at your leaders. Okay. It's war on the field. It's war on the field. It's war in the politics room.
Let me ask you. Let's go backwards. What inspired you to play soccer, and when did you realize it could become more than just a game?
The inspiration to play football. I'm calling football because that's why I know that. The first time I played soccer. Very time I played soccer, I went to watch some friends. I went to a family's house, and across the street there was a soccer game going on. And I asked my family, "Can I go watch?" So they said, "Okay, go watch." So I'm sitting there watching the kids play. Kids above my age. I was about.
How old were you?
About 7. Right, these kids were about like 10, 11. Right, so they're playing, and then I asked, if I could join in. So the gentleman that was, playing, coaching, refereeing the game, said, "Go ahead, come on." Listen. I was in that field for about 10 minutes. They never passed me that ball. They never passed me that ball. Okay? Kept running up and down. Never give up. I decided to just stick the ball from one of my teammates. Oh, yeah. They're passing the ball. I took it from him. Before he got it, I intercepted it. And then from there, that's where the magic began. Scored my first goal. And after that, I received every pass. Before the game was over, I scored 6. That's when the chain reaction started. And from then, I ended up going to school at it was a private institution called l'Institution Chrétienne de Pétionville. Yeah, that's where my father was a teacher at. So I attended that school. It was a private school where they had a soccer team there also. Right? So I made the soccer team. And our soccer team was being coached by Philippe Vob. You know Philippe Vob?
Nope, elaborate.
Philippe Vob was one of the best Haitian players out of Haiti at that time. He made the World Cup team in 1974 when Haiti beat Italy. Right? He was on that team with Mano Sano and all these guys and Piquant. So he was he's probably one of the 3rd best players out of Haiti. He was also trainer for our school team. We went to an elaborate private school, right? L'Institution Chrétienne de Pétionville. So from there, I kept playing, and then in the neighborhood, you know what I'm saying? Like on Sundays, we had Sunday leagues where I had my own team, which was called the Shoeless Ones.
The shoeless ones? You had no shoes?
Yeah, shoeless ones. And we had no kits. We had no uniform. So what we did was, like, I asked every player to. I was the coach, the manager, and the trainer for the team. Right? Because the kids that I played with, you know what I'm saying, they were underprivileged. They couldn't afford things. I couldn't afford things because my family resided in the US at that time. So I was able to get things, sneakers, t-shirts, and all that stuff. But I decided to play barefoot too, because they were bare feet. But guess what? We had the best team in the neighborhood. Nobody beat us.
Okay? The shoeless one.
Okay. Yeah. So fast forward now, came to the US, right? I didn't play soccer for like maybe 3-4 years when I landed in New York, 1987, right? I didn't start playing soccer until like maybe like 1992. So about 5 years expired, never touched a soccer ball. I never knew about soccer clubs and, you know, and how to participate in the soccer federation, you know, these things that's going on in the United States. Kept on playing Sunday soccer until someone mentioned to me, listen, you're good enough to be professional, right? But I was always that child that I enjoy training. I enjoy running up and down. I enjoy climbing hills. I enjoy doing physical activities. So in some ways, since I was a child, I kept myself fit, kept myself strong, because I enjoy doing it. You know that, Joanne, right? So now in the US now, I went to college. I went to Queens College, and there was no soccer team there. There wasn't allowed to have a soccer team because of, you know, conflicts and things that happened. Soccer team was banned. So that was my chance of playing soccer for college. Apparently, I dropped out of college. Forcibly, I was compelled to drop out. Not a decision that I made on my own. I was compelled to drop out by a decision made by other people. Okay, so that took me a whole different path. So there goes the career for the soccer, college soccer playing career. So one day, I got sick. I started working construction. Started working as a construction worker. You know, I stopped going to college. Now I'm working as a construction worker. Like every morning at 4 o'clock in the morning, I'm up on my feet, going to work. You know, I'm on the rooftop. Whatever it is I have to do, I'm doing. Right. I'm still young. I'm only about like 19 years old, working on the construction site. Okay. Because like I said, like hard work is never meant, like, it wasn't hard to me. I'm used to the physical life. So I end up being sick from working too hard, from heat exhaustion, from working in the sun, and you know, like working around tar and asbestos and all that stuff. So I ended up getting sick, being rushed to the hospital, right? And then I was put on sick leave for like a year. Suffered from heat depression. Couldn't go outside in the sun. I go outside in the sun.
I thought that was only for white folks. I didn't know it was for black folks too. My God.
Yeah, because I was always dressing like, I'm talking about like 100 degrees outside, but I have on a coat, sweatpants, boots, hats, mask on my face, breathable, because I'm working around tar. Mm-hmm. Right? Tar, and that stuff get on your skin. You just peel your skin off. And breathing it is very toxic to your system. So I'm around that stuff all day. Plus, it's 100 degrees outside. The tar is boiling at about 1,000, 2,000 degrees. That's how much. That's how high the temperature of the tar can go up to, 2,500 degrees. So I'm in that stuff all day. Uh-huh. Plus, I have the clothes on. So can you imagine how hot I'm feeling on the inside? So all that caused me to get sick because I was very young for that kind of work.
So how did you end up in Europe?
Well, this is where it all started. From getting sick, I couldn't go outside in the sun. Mm-hmm. I had to stay home all day. Right? The only time I can go outside was early morning and late afternoon when the sun goes down, when it's cool outside. It took me a while to recover. And then I became very, 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 very skinny. I lost a lot of weight. So one day I decided, you know what? Living like this is not good for me. I have something else in my mind I want to do. Yeah, so I saw myself outside of the living condition I was living in. And that coupled with the life that was surrounding me on a daily basis. I grew up in Brooklyn. Okay. 80s.
All day, every day. That's what's up.
Yeah. And I grew up in one of the parts of Brooklyn that was one of the most dangerous parts of Brooklyn, East New York. Okay, where every day you could be walking outside and somebody's getting shot around you or somebody's laying on the floor dead. So that life for me wasn't attractive to me. So I got to a point where it's like I had to do something about my life. I have to do something with my life. So I sat in my room one day, and I had a globe. I decided, you know what? I need to get out of here. So I took the globe and I put it in front of me. I said, okay, I'm going to spin this. I'm going to spin this. Wherever my finger lands, when I open my eyes, I'm going to close my eye. Wherever my finger lands, that's where I'm going. So I took the globe, spun it, closed my eyes, stopped it. When I opened my eyes, my finger was on England. England. I said, okay, well, England it is. That's where we're going. Now, mind you, I had no money. Don't know how to get there. I got no family, no friends over there. None of that. Can I go back for a second? One of the reasons I made that decision to go, and then he pointed me to England, was because prior to that, I was playing soccer at Prospect Park. I was at Prospect Park playing soccer, and there was a gentleman watching us play, just friendly, watching us play. And after the game was over, he introduced himself to me. He said, man, I watch you play. He had a British accent. He said, I watch you play. You're very good. I said, how old are you? So I give him my age. He said, listen, I'm gonna make a phone call for you. This gentleman, I can't remember his name. I forgot his name. But this gentleman at that time was on vacation in New York. He was playing for Charlton Athletics in the old English Premier League, the first division. There was no Premier League yet. It was the old first division. He was playing for Charlton Athletic, which was at that time one of the best teams in Europe, in England. He happened to be on vacation in New York. Saw me playing. Listen, his words were truth, because he called the coach. The coach called me, took my name and everything, reserved me a plane ticket to travel to Europe. One day, when I really saw it happening, I got cold feet. That day when he called me, and then he said, he called me, and my mother said, Marv, the coach is on the phone for you. I got so scared. Because I saw what was about to happen. I jumped on my bicycle and I rode away. I didn't go to the phone. I have never spoken to the man. I left him on hold for the whole time until this day. Never went back to the phone. See, the opportunity was given to me at that moment. And I turned it down until that day when I made a decision to go on my own. It just so happened, it's not coincidence that I spun the globe and my finger landed on England. Same place where the man is from. So like I said, I had no money. I didn't know how to get there. I had no family, no friends, nobody, no contacts in Europe. But I said, I'm going to Europe. I had a friend of mine that used to work for Delta Airlines, JFK Airport. Every afternoon we play soccer on Linden Boulevard in Brooklyn. That same afternoon, went to the park. He just happened to walk up to me and say, listen, would you like to travel to Europe? Because they all knew me as the best soccer player in the neighborhood. So he said, would you like to go to England? Just like that. He said, I could give you body passes. I said, yeah, okay.
That works.
Now, here we go. Here we go. Now I decided to go to England. Now my friend works for Delta Airlines. He just offered me 2 body passes to go to England the same day that I made the decision. So within a week's time, I was on a plane going to Europe. From the time I made that decision. I got to the airport. First I got in the taxi. I was crying tears. Because I'm looking back. I'm going to the unknown. And I'm crying tears in the taxi. The taxi driver was a black African man. When he turned around, he told me, listen, everything's going to be all right. Just swallow your tears, keep moving forward. That's all he told me. Swallow the tears, straight to the airport. I told my father and mother I was leaving. Got to the airport. There's a man and his wife sitting across from me, just watching me and smiling. Got his hat on, uniform, his badge on, with all his stripes and epaulets. He's a pilot. He's a pilot. He's supposed to be flying that plane, that Delta plane, to Europe that night.
Right.
Like I was told that before every flight, every pilot have to take like a test or something to see if they have any palpitations or whatever going on in the systems, right?
Right.
What happened that day? He had palpitations. He happened to be sitting outside in the waiting area like everybody else to go on to board the plane as a passenger that day, not as a pilot. So him and his wife called me over. Say, where you going? They saw my bag, I had my duffel bag, everything. We said, where you going? I said, I'm going to England. For what? I said, I'm going to go play soccer. So you good? I said, yeah, I think I'm pretty sure. I think I'm pretty good. I think I can make it. He said, you know what? That's some confidence right there. He said, you have any family and friends? I said, nah. I said, I have no one over there. I don't know where I'm going. I'm just going to England. You know what? The reason we're sitting here right now is because I'm supposed to be flying the plane tonight. And because they detected a palpitation in my heart, I'm not eligible to fly the plane. So I'm traveling as a passenger. So this is what I'm gonna do for you. Take this number. When you get to England, call this person. Call that person. As soon as you land, tell them that such and such referred you, and they'll give you an hotel room to stay in.
Wow.
Yeah. They'll give
So
you a
from
place
the
to stay.
flight to your location and everything. So
My
you got to
place-
sum it up because we only have 2 minutes.
Yes. So
How
I
did
went
you-
there. So anyway, so long story short, I got to the hotel. I went to the club. I wrote a letter. I walk over to the club. I leave like 2 minutes from the club. I walk to the club, wrote a letter, which is Nottingham's County from FC second division at that time. Walk to the club, walk to the administration office, drop the letter off. Walk back to the hotel. By the time I got back to the hotel, the club called the hotel. Walked in the door. The front desk lady said, "Mr. Lewis, the club called you. They want you to come training tomorrow morning."
Wow.
And that's how it started.
That's all. Wow.
So faith. That's a faith journey. That's
Not
a faith journey.
Not just faith, is just like making a
decision.
decision, a risky decision.
Mm-hmm.
And when you make a risky decision,
Step out on faith.
the universe rewards you.
Mm-hmm.
Step out.
Right?
Yeah. So now,
Rewards you.
when you were playing, who were some of the players you came across, or some of the countries you came across? Because you represented England, right?
No, I'm playing for a club team, not necessarily England. I'm playing for a club team that is based in England,
Mm-hmm.
right? I was allowed to participate in non-fee games, only free matches, because not given a work permit, I wasn't allowed to play in matches where the fans are paying to come in. Okay, soccer in Europe is a full-time job like everybody else, right? So without having a work permit, I was limited to playing in front of the crowd, but I can play in free base matches,
Mm-hmm.
where I still get there's still a crowd in the stadium, right? So that went on for years, trying to get me a work permit, couldn't get a work permit. I went to lower division clubs, still trying to get a work permit. The club offered me an arranged marriage with a woman from Sweden. They would have sent me to Sweden for 6 months, get married, and then become a European citizen. And then after that, I would have to worry about work papers anymore.
Wow.
Yeah, that was Sam Allardyce. Sam Allardyce was the coach for the English national team, U23 national team. At that time, he was the coach for Nottingham County.
Definitely. Marvell, you know what? We got to invite you back on, man, so you can go through some more give us some, basically, man, this is very inspirational for a lot of us, especially those immigrants who come in, have a dream, and given the opportunity to fulfill those dreams. But Dr. Brian, please, we have to get your trainer back on here.
So, okay, Mr. Marvell, you might have to come back on next week before the soccer tournament finish. You might have to come back on next week, because the thing is, you have to continue your journey and give us some tipsters. Who do you think is going to win, actually, before you get off? Who do you think is going to win?
France.
You think France is going to win?
Yeah. I'm going for France.
Okay.
Yeah, I'm going for France.
Okay. All right. So I'm going to cut you short. How can people reach you? You didn't even mention everything that you do. So how can people reach you?
Personal trainer, soccer trainer, athletic trainer, okay, youth mentor, right? Telephone number is 631-782-9127 or fitbird10@yahoo.com. And I'm also on TikTok at Shwal Malin. The reason I chose the name Shwal Malin because that's who I am. I'm a free man. I'm not attached. Nobody can saddle me. I run the forest free.
Amen.
Okay.
Yeah.
So hopefully we'll see you next week.
Yes, ma'am.
and you continue this conversation. So we want to thank all our listeners for tuning in. We want to thank you for joining us. We want to thank Dr. Braha for joining us.
Yes,
Health is wealth.
yes, ma'am.
So please take care of your health, physically, mentally, emotionally, all of that
Yes.
encompass a better individual.
Yes,
So
ma'am.
please, wishing everybody a safe weekend. Happy birthday to all those who actually are celebrating. Be safe, and we'll see you next week.
Bless.
Very much. Y'all have a
Bless.
good night.
You
All right.
too.
All
Bye
right.
bye.